Number 18, on page 18, any and all documents reflecting the Department of Public Health's decision to disable public comments on its social media posts on or about August 4th, 2022. Were you involved in that decision?
The communications office made that decision and then informed me of it to see if I had any objections.
Did you have any objections?
I did not.
Did you have any concerns?
We discussed making sure that at the town halls, people would be able to ask us questions.
And how do those town halls work?
I can't talk about how the platform works. I can talk about how we organize the town hall. We have various presenters that talk for a couple of minutes each on the topic for that town hall. They're generally clinicians and public health practitioners. I usually am moderating, and then after those short presentations, we open for questions from the general public and try to get to as many of the questions as possible related to the topic that's being discussed.
And how are those questions moderated?
I would not know the answer to that.
Are you the person who gets to ask the questions of the panelists?
I'm given a list of questions that come, because I think there's a variety of ways that people can ask us questions. And so I will be given a list of those questions as they're coming in, and then I will go ahead and ask as many of those questions as I can.
But you don't always ask all of the questions.
We never have time to ask all of the questions.
Are you aware of whether or not all members of the public participating in the town hall can see the questions being asked?
I have no idea how the technology works.
And do you select the clinicians and the public health practitioners who speak on these panels?
I will do that with my team. You know, we really are responding often to questions that are being asked of us. So if there's a new guidance on vaccinations, for example, we'll do a town hall on vaccinations. And then we'll have our experts on vaccinations present the information.
Would you ever invite a clinician or a public health practitioner who has views that are divergent from yours on best practices with respect to COVID?
As far as I recall, all of the presenters at our town halls are people who work at the Department of Public Health.
Okay.